Hello there, Dr. Brian McKay, Core Health in Darien. Today, I'm going to answer some common questions. The how as it relates to knee pain. So, how do you get knee pain relief? Well, let's go initially. Initially, the easiest thing to do is use rest. Uh, if it hurts, you can ice it up. If it hurts, you can take a leave. And basically, the old standard is rice: rest, ice, compression, elevation. I don't know how much compression you really want to put on the knee because if it's inflamed. So how about the rest, the ice, and elevation? So that'll take care of a couple things, but it won't really make the situation any worse. If anything, it takes the swelling out, the inflammation is in there. So the how part of addressing a knee pain is it's well, like I said, you can take non-steroidals like Advil or Aleve. Some people take Tylenol. Tylenol is really not going to do much for a knee. Um, the acetaminophen is not the same as the pain relief you're going to get with Advil or Aleve, which are again non-steroidal anti-inflammatories. So the bracing is another good thing. I mean, the bracing will help support the knee. That's a really good thing. And massage of the think of things that insert into the knee. You have the calf muscles insert to the back part of the knee. Those can be really tender. You have tibialis anterior in the front part, probably the bigger muscles be involved with. And then also you have the quadriceps and the iliotibial band. And the hamstrings to a certain extent. I don't really see a lot of issues with the hamstrings involved as much with a case for that causes knee pain. Now you got, how does knee pain occur is a question I get all the time. I mean, all the time. And knee pain occurs, okay, let's start with the most common. You have autoimmune diseases like psoriatic or rheumatoid arthritis. Hands down, those are the most common. There are other types of arthritis, but arthritis is basically, to simplify it, arthritis is when two bones come together and they wear away. And you have pain, lack of mobility, and decrease in the joint space. It's kind of a very simple definition. But over a period of time, that arthritis starts to wear away the bone and really gets a little nasty in there. So, what can you do? Well, you can exercise. That's a key thing. You can lose weight. But then again, losing weight is the answer for a lot of different things. And I'm in that same boat, so don't think you're by yourself. Cycling is really easy on the knees. Swimming is the type of exercise that's easy on your knees. But I'm going to give you an exercise that's really simple to do. Sit in a chair and go to standing. Now, if you're older, you could do, have it sit in a chair that has got a good arm support. And I'm not talking about like the Barker Lounge or the chairs over by the TV. I'm talking about a chair, something solid to sit in, so you can go to standing and go back to sitting. I tried that 20, 30 times and see, you'll feel certain muscles working you maybe hadn't before, and possibly it may make it. You'll start to notice it might be a little bit easier to get up and down the stairs. Those like the so let's get back into how the knee pain occurs. So you have rheumatoid, psoriatic, osteoarthritis, or DJD, degenerative joint disease. The meniscus is if you had a spinal issue, the meniscus would be the equivalent of a spinal disc. It acts as a cushion, it's a cartilaginous type material. So with the cartilage in the knee gets squished, think of it this way: when you extend the knee, that's when you would kick the leg forward, like you're going to go kick a soccer ball or kick a football. As you bring the leg forward, what happens is at the end of that motion, it's not just like a door opening on a hinge. There's a screwing motion at the very last bit where you kind of lock the knee into extension so your legs don't give out when you're standing. So hopefully that makes a little bit of sense. So what ends up happening here is you have that meniscus gets dinged up a little bit over a period of time, especially if you have tension from iliotibial band, the knee muscles, primarily the sartorius, rectus femoris, and the vastus medialis. Those could put some extra stress onto that area, which nobody needs basically. So the idea there is that's where a good massager, and these really really powerful handheld massagers nowadays. I mean, the hypervolts is really a phenomenal thing. We use it here at Core Health. Just about every patient. Just what happens is it gets the muscles to relax, so we get better treatments. So so these are all different ways. So now let's go. The basic way we know knee pain can occur is through trauma. You're a football player, a soccer player, a skier. Those kind of traumas, you develop more serious issues with like the anterior cruciate ligament, which is kind of connects your knee, the femur to the tibia. Tibia is the big bone below. You get the fibula on the side, which is important, but it doesn't really connect to part of the leg. That's really just the femur and the tibia. So you can have a tear, and that's going to cause knee pain. And the anterior cruciate, a lot of time, well, more often than not, that's going to be the one you may have to have operated on. Whereas the posterior cruciate, sometimes you can go without having that operated on. So it's not a bit, listen, there's no such thing. And just think about this, it's a crisscross pattern, so an X. So you have the posterior cruciate towards the back of the leg, the anterior cruciate towards the front. Both important, but you can certainly survive with just, if you tear the anterior cruciate, you're not going to be seen here by any stretch. So a lot of times people go, can knee pain be cured? Yeah, if you're overweight and you lose weight, great. If you're not exercising, you start to exercise. And here's another thing too people don't also think about is fish oils. Fish oils are a phenomenal source of essential fatty acids. Notice I said essential. An essential fatty acid is something that your body needs but cannot produce on its own. So what we do is we supplement with really good fish oil. And recommend that to all our patients because it really does make a difference in lubricating. It helps to lubricate the knee. So, there's different ways to cure knee pain. That's another question we get all the time. Well, you can have knee replacement. That's going to cure your knee pain. It's going to be a painful process, but end results, people do pretty well with knee replacements these days. It's fairly common. So that's one route. Surgically, you have the meniscus gets a little tear in it, and it irritates, again, when you have that extension where the leg kicks out, where as if you were kicking a soccer ball or a football, that's going to occur, it's going to irritate. So the meniscus can flap over. It's like a figure eight shaped hunk of cartilage. And when you're young, it works fine. But trauma can make the biomechanics really tricky. As a matter of fact, something to be cognizant of is if you have poor foot biomechanics, that can also be a major cause of knee pain. So you want to get those feet checked out. Now, I'm a chiropractor. I check feet all day long. A lot of my peers do not. I think it's very important. You have to balance out the pelvis, and if the feet aren't balanced, it could set the knees out, which set the pelvis out, which sets the low back out. So pretty important to have the feet evaluated. As a matter of fact, let's put that on the list as one of the more important things you can do for yourself. Besides losing weight, exercising. Now running. Listen, running is something people love to do, and I'm not going to say don't run if you like to run. It's really not that way. It doesn't have to be that way. So, the thing is finding that right exercise. Swimming is not going to damage your knees unless you kick into the side of the pool. But for the most part, it's really one of those type of things where you should be fine. Have at it because it can be fun. Walking upstairs might be easier. As a matter of fact, if you're elderly, if you're feeling that twinge in the hinge with the knee pain, why don't you just go up and down the stairs or take the stairs instead of taking the elevator and give yourself a little bit more extra exercise. And that going from seating to standing is a wonderful way to do it. Very, very good. Or buy one of these home massages. You'd be surprised at how many points on your leg will be painful when you when you start to massage. You're like, wow, that's kind of. So hopefully I've identified different types of knee pain. Is it arthritis, trauma, DJD, osteoarthritis, the old age, psoriatic, rheumatoid, which are autoimmune. The autoimmunes are, if you have to pick up what type of knee pain is bad. You can also have cancer in your knee. You can also have patellofemoral, where the patella is the thing that rest on top of in front of your tibia and your fibula. And about people consider that the knee. The knee is really the joint itself. But the patellofemoral, sometimes the patella doesn't track properly, and that can cause an issue. And stuff like that can be helped. I mean, there's different surgeries which will help, really bad patellofemoral syndromes. So we have, the bad stuff is cancer, or when the knee pain is bad is the one you can no longer live with. And that's when you pretty much got to opt for knee replacement. The knee replacement is not you do enough of them these days. Hopefully you'll catch a good doctor and you get a quick recovery. And there is pain involved. How could it not be? Cut off a bone, but the end result is the quality of life will probably raise up dramatically after your surgery. So let's go back to, I guess let's put the shameless plug in for what we do here. Core Health has a really unique knee program. What we've done is we've combined, let's go with the trigenics. Trigenics is identifying certain muscles that you may not be aware of and working these muscles to relax tension on the knee. Okay, that's just one part. Other thing we do is we have this knee on tracks machine, which is a gentle traction that stimulates production of synovial fluid. Synovial fluid is that lubricant. It's that lubricant that is in the knee joint. Viscous, very sweet. Maybe I'm saying sweet. It's got a high sugar content. So if your knee gets infected, a lot of times that's problematic because the sugar in the high concentration of sugar in the synovial fluid will make infection spread rapidly. That's so what happens here is we produce it naturally. I guess what I forgot to mention before is some people will go for injections of a substance, man-made. They'll actually have real and synthetic, called hyaluronic acid. And that's one of the major components in synovial fluid. And as we age, our body produces less synovial fluid. So the idea here is that you would inject it, and it's sometimes synthesized from rooster cartilage. Rooster cartilage has been found. And those knee injections that people talk about kind of work like 40% of the time. So it's like if I was going on a long trip and wanted to get knee relief, yeah, you definitely do something like that. It's not a jump on it, man. Especially stay out of pain for the trip, but chances are it's not going to last. As a matter of fact, I really don't know anybody who's had knee injections have it last. So unfortunately, that's what you face. But you'll still see people getting them, and like I said, give it a try. If it works, great. But don't be surprised if it comes back. The knee pain comes back. The other thing too, there's so many good exercises at the gyms these days for knees, and you make it a focus point. You're going to go to the gym and have this stuff done. Like we here in our office, we have a cycle. We have different, knee flexion, knee extension, equipment in addition to the knee on track solution, which is phenomenal. A 5-minute treatment, and it just adds that little extra bounce that you're missing in the knee joint because the fluid volume is low. So I can't say enough about that. Now we also have the Matrix machine. The Matrix really works more on the cartilage. Okay, so the cartilage is made up of cells called chondrocytes, and the chondrocytes are stimulated by this particular electric frequency. So by the thing here is you're on this treatment for about 35, 40 minutes. So it's not a short treatment, but the idea is if it does to help reproduce the cartilage, think of the value that is to you and adds to the quality of your life. And I think that's really a tremendous, tremendous boost when you can sit there and see a tremendous difference in how over a period of time, and the treatments don't really last that long. It's somewhere about 20 treatments, and even people who've had knee replacement surgery can benefit from the knee program we have here at Core Health. So it's really a solid way, to get that relief. So now listen, if you had knee replacement, it would have to be at least a year before we would touch you. But not all knee replacements work. The knee replacement is not going to produce synovial fluid, but depends if you replace the top part of the bone or the bottom part of the bone, you may not need it, but the synovial fluid to surround the joint is going to be helpful. So here's a couple of different things you can do. You just do, like I said, go from sitting to standing. just to keep exercising. But those that really work your knees, it also work your core. So not a bad thing. Definitely not a bad thing. The other thing is you can take the non-steroidals, the Advil or Aleve. Don't waste your time with Tylenol. You can ice it. You can elevate it. You can rest it. These are all good things. Um, Basically, you can, and as well, you can massage it. But if that doesn't work, or if you try basic physical therapy, listen, physical therapy is wonderful, but smart physical therapy, and I think that's probably was that the way we do a knee problem around here is, now we don't do total knee replacements. We don't take a patient comes in, we don't do that total knee replacement type of physical therapy. It's not our specialty. Our specialty is avoiding that, or last case, worst case scenario, you come in and get the treatment after the knee replacement doesn't work, the total knee replacement fails. So listen, if you got questions, you can always give me a call. Don't always know if I can answer it. My number is 203-656-3636. Dr. Brian McKay, Core Health in Darien. I've been in practice for about 30 years, seen a few things. Actually, another thing, too, before I let you go, that sometimes the femur misaligns. There's a tendency to go to rotate internally or externally. And by addressing that, we can, again, take out a little bit of a sting when the leg goes into flexion. Flexion, always think about kicking a soccer ball, kicking a football, that particular motion, lockdown. So it makes it a lot smoother because when the joint locks into place, it's like a hand in glove type of a fit instead of doesn't fit properly, which then irritates the meniscus and can cause further erosion of that meniscus, causing you more pain. All right. I think I've beat up this subject way, way too much. But the Knee on Track solution is a great way for you to get relief from your knee pain. I am Dr. Brian McKay here at Core Health Darien, 551 Post Road, 203-656-3636. Have a great day.